morning, all. My name is Dr. Hillel Mazansky, and my areas of expertise are in medical hypnosis, guided visualization, nutrition, and exercise. One of my mantras are the mind causes all one's physical and psychological ailments. If the mind causes it, which it does, the mind helps heal or treat it using medical hypnosis, guided imagery, nutrition, and exercise. Today's health tip is entitled When Depression Creeps Up Upon You. The vast majority of us over the entire world has developed or experienced some type of depression. And that is usually the loss of a child, the loss of a parent, work-related issues. And generally speaking, the depression is not in long duration. However, when depression does become an issue, is if after you are feeling sad and down for a period longer than 3 months, then we term it depression. There are two types of depression, namely major depression or bipolar depression. Today's discussion will center more around major depression than bipolar. Depression not only occurs in childhood and in the teen years, but also in early adulthood, but it can also set in later on in life when one is in the mid-40s to 45s for females and males at around age 50. There are many causes for this type of depression, and we'll discuss them briefly. First of all, depression can result from a host of different causes, but we will dwell more on the treatment. For example, in middle age, the hormones begin declining. In men, it is testosterone, and when the testosterone level decreases, it can result in increasing amounts of depression. The treatment for that is simple. You get a blood test done to check the testosterone level, and if it's low, there are many testosterone gels or creams that can be used. Similarly, in females, at 40 or 45 years of age, they begin going through the so-called menopause or perimenopausal symptoms, such as hot flashes, irritability, nervous, anxiety, and depression. While we do not recommend females to take hormones, some are using natural hormones today, natural estrogen and natural progesterone, which is certainly better than the Premarin, which is made from horse urine and can result in heart disease. Mentioning heart disease, both heart attacks and heart failure, as well as coronary artery bypass, is definitely related to depression. Many studies have proved this. The longer a person stays in the intensive care ward, the more the depression increases. And this can sometimes be a daunting task to treat the depression, but some medications can be used although they have heart disease. Diabetes, type 2 diabetes mainly, is related to depression, especially when the blood sugars are out of control. Insomnia can contribute to depression. There is no doubt in that. And depression can in turn affect one's sleep pattern. It is important, if you have depression, to get an adequate night's sleep, and also sometimes for depression counseling is used and medication. We have been fortunate enough to see many patients with depression who come to us and they say that they've tried all the various modalities without much success. Under hypnosis, one delves into the subconscious mind, and oftentimes we find the real cause for the depression. Sometimes it is so severe, such as childhood sexual abuse, or childhood parental or other abuse, physical abuse, can lead to depression. But those facts are so painful to the patient that they repress it, called repression. Under hypnosis, however, we are able to bring it to the fore and discuss it with therapy. So sleep is of a great importance. Many patients also who suffer depression tend to oversleep and can sleep 12 or 15 hours as they do not feel like getting out of bed. And when they are asleep, they do not feel or experience the depression. Taking high blood pressure pills, especially propranolol, that can cause depression, and it's used for high blood pressure. If that occurs, I suggest you speak to your healthcare providers, because there are many other anti-hypertensive medications that can be used that do not affect depression. When one goes through life changes, such as upon retirement, or if they were terminated from their job, that can lead to ongoing depression, which sometimes becomes severe. The remedies, of course, for that are to try and find another employment. And in retirement age, depression can come to the fore because the people are not gainfully employed, and depression is especially high amongst those who do not have any hobbies or outside interests. For depression, nutrition helps a great deal, especially eating fish or other products that contain omega-3 fatty acids, such as flaxseed oil or krill oil. That can help the depression. Vitamin D3, a shortage of which is related to depression without a doubt. So it behooves a person suffering from depression to get a blood analysis done of their vitamin D level. And researchers out of UCSD has suggested that adults have a minimum of 5,000 international units of D3, and then have the blood test done again, because oftentimes 5,000 is insufficient. For disease prevention, the blood level should be between 40 and 50 milligrams per deciliter. Vitamin B12 is also purported to help in cases of depression, especially if you are a vegetarian or a vegan where you do not eat meat. Red meat is the main source of vitamin B12. So taking an oral substance of vitamin B12, 1,000 micrograms per day, can do you no harm. It can do you only good. Many of the antidepressant medications have all got side effects. And then physicians and psychiatrists tend to give a different medication to combat the side effect. Hypnosis is non-toxic and it has no side effects. Chronic pain is another trigger for depression, and it is a vicious cycle in as much as chronic pain aggravates or leads to depression, and when one has depression, the chronic pain is aggravated in cases such as fibromyalgia, migraine headaches, chronic lower back pain, irritable bowel syndrome. All those issues of arthritis, all those issues that cause chronic pain can also cause depression, and managing the chronic pain through hypnosis can help alleviate the depression. Exercising is one of the most important physical activities that one can do to combat the depression. And the answer is simple. When one exercises, especially when the pulse rate is increased and you tend to perspire, the endorphins, or the feel-good hormone in the brain, is increased, and that has a positive effect on depression, as it is also, endorphins are called the feel-good hormone. Laughter therapy can also help. Listen to comedies, go to movies with comedies, watch comedians in action. Well, you might rightly say when you are depressed, you do not feel like laughing, but if you do laugh, the depression will dissipate. So, treatments for depression other than medication are nutrition, exercise, sufficient sleep, counseling, and if that doesn't work, medical hypnosis. On my website, folks, drmedicalhypnosis.com, drmedicalhypnosis.com, there are many videos there available for depression, for chronic pain, for insomnia, etc. If you wish to email me about the content of today's health tip, or in fact any other health tips that I give you, my email address is drhm@gianinc.com, gianinc.com. My name is Dr. Hillel Mazansky, and I thank you for listening to this health tip.